Class, hello, and welcome to this middle years session on abuse. I will be your tutor, Big Owl. Today, we are going to look at what is meant by abuse, physical abuse, sexual abuse, emotional abuse, neglect, bullying. First, let's look at what abuse is. It is absolutely crucial that all early years practitioners working with children are aware of child abuse and that they consider their own role in protecting children. Today, we are more aware of abuse than ever before and have a very clear understanding of what constitutes abuse and what can be classed as effective behavior control. For example, in the past, beating a child was considered acceptable as a means of teaching a child right from wrong. Today, most of us would be horrified at this kind of treatment. There are four main types of abuse: physical abuse, sexual abuse, emotional abuse, neglect. Most of the stories in the news about children who have been abused have come from poorer families. Should we be more cautious about looking for signs of abuse in such children? Abuse can happen to any child in any family setup. Evidence suggests that most abuse is carried out by people known to the child, including members of their own family, friends, and sometimes even teachers and carers such as childminders and nursery nurses. It should never be assumed that a child who is from an affluent background is less likely to be abused than a child from a poorer family, as this is simply not the case. Why do people abuse? There are several reasons why an adult may resort to abusing a child, and these may include the lack of a bond between the parent and child, the failure of the parent to respond to their child, the failure of the child to respond to their parent, an inability by the parent to accept the parenting role, separation of the child and parent, stress and other factors which may contribute to a lack of interest in the child, such as poor housing, unemployment, and so on. Parents who have been victims of abuse themselves. What constitutes physical abuse? Physical abuse is the intentional infliction of an injury on a child by an adult, or the failure to prevent the infliction of injuries by another adult. Physical abuse may take the form of hitting, shaking, burning, biting, using excessive force when feeding, giving drugs or alcohol. It is important to remember that all children will experience some form of accidental injury throughout their childhood years, and they may well experience cuts, bruises, bumps, and even broken bones. The differences between genuine accidents and deliberate acts of physical abuse are the location of the injury, the frequency of the injury.
What about sexual abuse? Surely that would be far more difficult for us to identify.
The physical signs of sexual abuse can include bloodstains in underwear, difficulty in going to the toilet, and showing distress when needing to pass urine or have a bowel movement, difficulty sitting down or moving about, frequent accidents when the child wets or soils themselves, frequent infections of the genital areas, non-accidental bruising or scratching, particularly around the genital areas, vaginal discharge. These are more difficult for practitioners to identify, as many children do not appear to show many outward physical signs. However, although the physical signs may not be apparent, the behavioral indicators should be much easier to detect, and these may include appearing depressed or withdrawn, avoiding being alone with certain people, dropping hints or clues to try to tell you what is happening to them. This is known as a covert disclosure, exposing the genital area, losing interest in school and starting to perform badly in schoolwork, masturbating in public, painting or drawing images of a sexual nature, resorting to immature comfort behavior such as rocking or thumb-sucking, not usually associated with a child of that age, showing insecurity, showing unexpected fear of certain people, undressing themselves at inappropriate times, using imaginary play to act out behavior of a sexual nature, using sexual behavior not usually associated with a child of that age, using sexual language not usually associated with a child of that age.
Would emotional abuse be difficult to identify too?
Emotional abuse is when a child is refused love and affection. The adults caring for them may regularly threaten them, shout at them, ridicule, or verbally abuse them. The result of emotional abuse is a child lacking in self-confidence and feeling unworthy of love and affection. Children suffering from emotional abuse may find it difficult to form lasting relationships in later life because of the long-term effects of the abuse. Some children who have suffered from emotional abuse may resort to self-harm, such as trying to cut or mutilate themselves in some way. However, there are usually very few physical signs of emotional abuse. The main indicators of this type of abuse are behavioral, and these include trying too hard to please other people in an attempt to feel accepted, being fearful of new people and situations, being unable to trust people, becoming anxious, becoming passive, becoming uncooperative and attention-seeking, perhaps resorting to telling lies and becoming clingy towards certain adults, developing speech impediments such as stuttering and stammering, finding it difficult to accept praise, lacking in self-esteem, developing poor social skills and finding it difficult to mix with other children of a similar age, regressing with toilet training, resorting to comfort-seeking behavior such as thumb-sucking or rocking, resorting to stealing, resorting to tantrums due to frustration and a lack of acceptance, showing aggression, suffering from an all-round delay in their development, suffering from lack of concentration or lose interest in the things around them. It is important to remember that emotionally abused children are also at risk from sexual abuse as they crave love and affection and may look for this from strangers.
What's the difference between physical or emotional abuse and neglect?
A child who does not receive the basic care they need to thrive is said to be suffering from neglect. Children who are neglected do not receive sufficient food, warmth, or supervision, and they're often denied basic medical treatment. Frequently, children who are neglected are actually loved. However, their parents or carers may be suffering from personal problems, or they may simply lack the necessary knowledge required to provide for their offspring. Neglected children may also have parents who are suffering from some form of mental illness or who are drug users. Neglected children will show both physical and emotional signs. Physical signs may include the child appearing unkempt, dirty, and malodorous, the child being underweight, the child not having adequate clothing suitable for the time of year, the child suffering frequent injuries due to a lack of supervision or adequate safety devices, the child suffering from minor infections and ailments on a regular basis which go untreated, such as earaches, coughs, and toothache, the child appearing to be constantly hungry, the child being tired due to lack of sleep or irregular sleeping habits. The clothing the child does have may be dirty and unwashed and will often be ill-fitting. Neglected children may also show behavioral signs such as talking about being left alone to fend for themselves or being in charge of younger siblings, acting responsible beyond their years. Perhaps young children appear knowledgeable in cooking and caring for others, which is not normally associated with a child of their age.
What about bullying? Does this have similar effects on children?
Yes, children who are bullied can experience negative physical, mental health, and school issues. These issues can often appear and continue well past the middle years and into adulthood. They are likely to suffer from depression, anxiety, increased feelings of sadness and loneliness, changes in sleep and eating patterns, loss of interest in activities that they used to enjoy. Some children who are victims of bullying have been known to seek resolution through revenge and retaliation. In the US, for example, there has been an increase of both harmful and, in some cases, deadly violence by children reacting to being bullied. Children that experience bullying may also abuse alcohol and other drugs in adolescence and as adults. Often, bullying is also connected to the suicide of those that are victims of bullying. However, many media reports suggest that children who are suicidal and are bullied are often also depressed, have other problems at home, have other traumatic history, or are in one of the common bullied groups, which are also often victims of social discrimination. To summarize what we have learned today, there are 4 main types of abuse: physical abuse, emotional abuse, sexual abuse, neglect. All of these can be equally damaging and have long-term effects. Practitioners need to be aware of all the possible signs of abuse, not just the physical indicators. Bullying can have far-reaching effects on a person's life, even into adulthood. Goodbye, class, and good luck!